What if we realize that food can not only nourish us, but also heal us? Let us make a disclaimer here that there is no food in the world that can cure pulmonary hypertension, but there is food out there that can make our bodies stronger, our minds healthier, and our lives easier. There are ways of eating that can help us escape our everyday fatigue and increase our capacity for physical activities. There is also food that can harm us and make our disease experience worse than what it actually is. Today, we will learn about all these foods, the hows, the whys, and the whens of it, and we will learn to empower ourselves in ways we have never thought possible. To guide, educate, and inspire us today, we have with us two amazing doctors who not only have immense knowledge on this subject, but who also practice what they preach. Today, we have with us Dr. Marjorie Patricia George from Denver, Colorado. She is a pulmonologist and director of the Pulmonary Hypertension Program at National Jewish Health in Denver. She is the co-founder and president of Team Phenomenal Hope. She is also the editor of her blog, Low Carb Lung Doc, where she writes about nutrition and lung health and also talks about how metabolic health impacts our general health. She is an ultra cyclist herself. When she isn't busy saving lives, she can be found cycling through some beautifully harsh terrains and trails. We also have today Dr. Pallavi Aga from Noida, Uttar Pradesh. She is a radiologist with a deep and personal interest in food and fitness as medicine. She is a proponent of low carb and keto diet as well as fasting protocol. Her vision is to build a medicine-free society. You can also follow her on her website, drpallavi.com, where she shares her valuable advice on various health issues and how to deal with them through the right nutrition. Don't forget to check out both these medicine heroes' Instagram. I now hand over the floor to Shalaka, who will begin the session. This is going to be a Q&A between her and the doctors.
Thank you, Ranjan.
Yeah.
Let me pin everyone. Hello, doctors. Thanks for doing this today with us. So I'm going to start. Yeah. You want to say something, both of y'all?
Just wanted to say thank you so much for welcoming us. Good evening. And really looking forward to learning from Dr. Pallavi Aga and all of you today.
Dr. Aga, you're muted.
It's my pleasure entirely to be here today, and absolutely I share and echo your sentiments, Dr. George, and it would be wonderful to hear all what you have to tell us, to teach us about low carb and pulmonary hypertension. And thank you for having me here today, and let's move on with this session.
Yes. Okay, doctors, my first question is on the inflammatory mechanism in pulmonary hypertension. And I would request Dr. George to explain that term to us and why it is important to all of us.
Okay, I guess, can I go to just a couple of slides?
Yes, please.
Because
yeah.
this is sort of part of how I introduce about pulmonary hypertension. I don't know how many of your people in the audience are brand new diagnosed, et cetera. So let me answer your question in a little bit of the context of the slides. Would that be okay?
Sure. Yes, absolutely. Please do that.
I totally turned the tables on you by saying I don't have any slides, and then I made slides.
No, that's okay.
Let me just talk about this real quick, and it'll help, I think, give us a little bit of a background, and then let's deep dive into it.
Yeah.
Okay, so let's just get right into it. So when we talk about, can you guys see my slides?
Yeah, we can. Yeah.
Okay, so today we're really focusing on nutrition, and I will talk about inflammation and pulmonary hypertension, et cetera. But before we do anything, I just want to be clear about the talk today. So if you guys listen to this and decide, oh, I want to change my diet, or I want to start a new exercise regimen, or anything like that, I always tell my patients, before you make a significant change in your lifestyle, talk to your doctor. It's always important to involve your team. We are supplying you with information, but it's always important to have your healthcare team on board with anything that you're doing, not just medications, but lifestyle as well, because it can have a significant impact on everything. All right, so most of you probably know this, but I just wanted to get a couple of introductory slides out there about what is pulmonary hypertension. So when I talk about it with my patients, I talk about how pulmonary hypertension is high blood pressure in the lungs. You can detect it on a screening study with an echocardiogram, but in order to truly make the diagnosis, everybody needs a right-sided heart catheterization to actually make the diagnosis by measuring the pressures in the lungs. We define it as a mean pulmonary artery pressure of 25 or higher at rest. And you can actually have it in multiple conditions. We have this whole classification scheme by the World Health Organization where we clump diseases, we group diseases by similar pathology, pathophysiology. And what we're going to talk about today is actually applicable to all types of pulmonary hypertension. I think nutrition sort of transcends this and also transcends chronic lung disease or chronic illness. So it's just an important pillar. But just really quickly, so everybody's familiar, we talk about group 1 pulmonary hypertension, which is pulmonary arterial hypertension. That's a disease of the arteries, stiffness and disease of the arteries themselves. That's where people with idiopathic PAH or connective tissue disease associated PAH or schistosomiasis, HIV, that all, PVOD, for example, that all falls into this category. The second type is PH due to left-sided heart disease. What we see here in the United States, and I think worldwide with insulin resistance diabetes, is now a higher preponderance of HFpEF, which is heart failure with preserved ejection fraction, which left ventricular diastolic dysfunction. The third type is PH due to lung diseases, hypoxemia. We see a lot of that at our lung center. That can include sleep apnea, but also COPD, ILD. The fourth type is chronic blood clots or chronic obstructions, namely chronic thromboembolic PH. And the fifth category, whenever you have categories, is stuff that doesn't quite fit into the other categories because of unclear mechanisms. So, I'll skip over this because you all probably know a little bit more. Thinking about the different groups, it's important. So how do we approach this? So when I approach patients with chronic illness, I really try to focus on improving our health, like literally one step at a time. So in our clinic, it's important to figure out, of course, the diagnosis, pulmonary hypertension, and get people on appropriate medications. So that's first and foremost. That's what lowers mortality, improves survival, improves, we hope, quality of life, ability to exercise, people meeting their goals. But then there's a whole lot of other stuff that's actually really important when we manage and work with somebody living with pulmonary hypertension or any chronic disease. So I talk about it being this stair-step approach. The first is, seeing the doctor, being placed on the appropriate medications, getting the appropriate diagnosis. But then it's important to, if somebody has an underlying lung disease, to treat the underlying lung disease. It's important if somebody needs oxygen or if they have sleep apnea, to treat their sleep apnea. It's important to get exercise. And a lot of our patients, they may have reflux disease. So we talk about avoiding, trying to mitigate or lower the impact of GERD that can be inflammatory. And then eating right and, practicing mindfulness and having good mental health, addressing anxiety, depressions, all of these things. I may not be able to help somebody go back to how they felt before they got diagnosed, like normal 10 years ago or whatever it may be. But the concept is if we can approach each of these stair steps, we can actually get people feeling better and even better than just medications alone. Like all of this is important. So one of the things we talk about are pillars of health. So in addition to medications, then it's important to really talk with people about their pillars of health. And what I try to address in every clinic note when I see people are their sleep, their nutrition, their mind, and like movement, exercise. And so today we'll be talking mostly about exercise. I can hold off here and come back to your question about inflammation. So when we talk about pulmonary hypertension, there are multiple mechanisms of the disease. And so there are, pulmonary hypertension is a disease of endothelial dysfunction and smooth muscle cell proliferation. And there are multiple mechanisms. We had our Aspen Lung Conference on this that are invoked in 2019. Multiple mechanisms potentially involved, from people who have genetic mutations, whether it's inherited or first-time mutation, people who have inflammation impacting this smooth muscle cell proliferation, people who have, and especially we think about that when we think about connective tissue disease, people who have cells that are just responding to an insult to the blood vessels somehow, or a systemic insult in a maladaptive way, i.e. pulmonary hypertension. And so there's certainly a role for inflammation. Now, when I think about inflammation, I think more about the concept of insulin resistance and how that affects chronic lung disease. Not necessarily, I could talk to you at length about the impact of, insulin resistance and where people are going with the impact on the right ventricle and how it affects the pulmonary vasculature. And there's a lot of animal studies and/or people are starting to really talk about that. But it's still being fleshed out in terms of what that exact role is. So when I think about inflammation, I think about overall body and just eating a healthier life, trying to correct that metabolic syndrome or insulin resistance, which we probably should talk about as well.
Okay. So this is a question to Dr. Pallavi. In the context of inflammation, we do categorize some foods as being inflammatory and some foods being anti-inflammatory. So could you say a few words on that? You're muted, doctor. Yeah.
Yes. So there are a lot of food out there which cause a lot of inflammation. And by inflammation, what we understand in a layman language is that you would automatically feel, water retention, you would feel bloated, you would feel mental anxiety, you would just, your body will tell you are not feeling well. It's extremely common to hear these low grade symptoms in not only in patients with pulmonary hypertension, but in general population. People coming to me as when I'm doing my routine, my normal profession as a radiologist, they're just feeling fatigued. Fatigue is that fatigue syndrome is such a common thing in most of the people, and this is because of underlying low grade inflammation, thanks to the quality of food which we are eating. Of course, you go ahead with getting the ESR done, the C-reactive protein done. It's usually elevated. The fasting insulin is usually elevated, and the bottom line to all of this is insulin resistance, as Dr. George has correctly pointed out. According to me, the topmost food which is leading to inflammation is definitely grains, and grains, gluten, and a lot of people dairy as well. So raw food, I mean, a lot of raw food is causing a lot of inflammation in people. So it's usually when we try to edge out these, the moment we take out the grains, that's actually when, after a week of not taking a no grain diet, the patient automatically starts feeling better. The water retention goes off, the fatigue goes off. It's remarkable and miraculous the way patients say that I'm just not feeling fatigued, I'm pretty much high on energy. So that's what is, how all of these grains and gluten, which is supposedly on the healthy list, is causing so much of inflammation in the body. And I don't know who put it on the healthy list.
We've actually had pulmonary hypertension patients also report this benefit after going off the grains.
And the problem is that now, I don't know about how it's there, Dr. George, in the West, in the US, but in India, this whole concept of coming, you take out the gluten, you take out the wheat, and then you are adding even grains like ancient grains like millets. But unfortunately, people are not understanding that those are pretty high in carbohydrates as well, and they are not actually doing us any good. They are actually pretty much inflammatory. So I would suggest that grains, in my opinion, are the highest source of inflammation, and in a lot of people, dairy as well.
Okay. All right. So this is a good point for us to start with the first topic, which is carbohydrates. So if either of you all want to take a hit at this one, what are they? And specifically for Dr. Aga, which Indian foods have carbs? Carbohydrates or carbs? Yes. Yes, Doctor.
Can I just do one thing? I apologize, Dr. Aga. I mean, unless all of you guys know what insulin resistance is, and unless, can I just go do a little intro?
Yes, please.
Absolutely,
Yes.
absolutely.
Yeah, you need to. You need to.
Before we deep dive, I really want to talk about this. And I also want to, I agree with what you're saying, but I also want to convey the importance that I don't want people to walk away from this talk saying, I'm going to fix my pulmonary hypertension by going keto. Okay.
No.
This is what we're talking. And that's why I really wanted to talk about that stair-step approach. Like, I'm rushing through it because I know you guys have a lot of good questions and I want us to delve, and we can, like, fine. But it's really important. Like, don't take that mess. There's some like alternative people out there that are like, I don't need my medications. I'm just going to go keto, or I'm going to go vegan, or whatever it may be. That's not what this is. Okay. So this is, again, stair-step approach, approaching that pillar of medicine, and from some broad strokes. So I'm just going to share my screen one more time. Yes. And then I just literally have probably three more slides, but I think it'll help frame this before we get there. Why am I painful? Let's see. Everything is, let's find this. Okay. Zoom. Okay. So, and then it'll make more sense talking about carbs and sugar and grains. Okay.
Yes.
So we talked about these pillars of health. Let me just frame. So, all right. So one of the things and one of the reasons I'm interested in this, not only my personal health and how I feel of when I avoid sugars and grains, and deep dive into it, is the fact that diabetes is really common. It's common in the it's common worldwide. It's on the increase in India as much as it is in the United States. And there's actually a pretty high number of patients with pulmonary hypertension and pulmonary arterial hypertension who have diabetes.
Yes.
And so in our clinic, we try to get to this concept of diabetes and obesity. And so when we talk about diabetes is one end of the spectrum of what we call insulin resistance. And when we talk about obesity related diseases, or diseases that are associated with metabolic syndrome, insulin resistance, which I'll talk about on the next slide, it actually encompasses a lot of diseases, from hypertension, coronary artery disease, type 2 diabetes, obstructive sleep apnea. Women can have polycystic ovarian syndrome. Men have erectile dysfunction, chronic kidney disease, non-alcoholic fatty liver disease, even dementia, anxiety. All of these are diseases that come off of people, this concept of insulin resistance metabolic syndrome. And the way modern medicine, at least in many places, we give medications for each of these conditions.
Yeah.
Now it's important to do that, but if we can address what's at the center of this, the metabolic syndrome, insulin resistance, what I argue is a lot of this other stuff will get better. And in fact, oftentimes we can, down the road, take people off medications for some of these conditions. So like the traditional approach to diabetes, obesity, et cetera, is, diabetes is inevitable. Oh, your mom, your dad had it, you're going to have it. A lot of Americans struggle with weight associated with diabetes. The doctors will say, you need to lose weight, eat less, exercise more, calories in, calories out. If you eat 3,500 calories less per week, you'll lose 1 pound. That's like the advice that's actually on a slide set that's part of an educational slide deck with one of our companies. And so I always talk like a lot off slide about that, because I think that these messages that we've been giving people aren't working. Like, diabetes is on the rise, obesity is on the rise worldwide. So what would work is this newer approach, which is actually a much older approach. It's like, go back to what your grandma and your great grandma did, at least in the United States. And it's called this hormonal hypothesis of obesity. So what is insulin resistance? So the concept is this: normal physiology, this is really simplified, but if you go and eat food and that food contains carbohydrates, and so carbohydrates are things that are starchy or have sugar in them, sugars and grains essentially, or potatoes, rice, which is a grain, that sort of thing. So you eat this, and as soon as you take this in, and it can be whole grain and it can be quinoa, it doesn't matter, okay? And it can be gluten-free substitute, just like Dr. Aga said, doesn't matter. You eat this and your blood sugar rises in your body, and your body, it likes homeostasis, which is a word that just means keeping everything even. Like your kidneys keep your potassium at 140 and your sodium at 140, your potassium at 4, like if you check blood values, things usually are pretty much even Steven. And that includes keeping your blood glucose within a certain range. So how does that happen? So the pancreas secretes insulin, which is a hormone our body produces to help bring the blood sugar down. So if the blood sugar gets lowered, we store it in our liver and skeletal muscle, which is very limited. And then when that storage center is kind of at capacity, it gets converted into fat and goes into fat cells. So when we eat sugar, carbohydrates, for us, standard American diet, when we eat these things and keep our insulin levels up, it's a fat storage mode. So when this happens over time, people will need to have higher and higher amounts of their own body's insulin. I'm like gesturing to my pancreas right here. That's where anyway, so they need higher and higher amounts of insulin in order to keep their blood sugar within range. And eventually when your own body's insulin doesn't do it anymore, you have type 2 diabetes.
Dr. Aga, you were saying, sorry, Dr. George, you were saying something?
Okay, so where we left off, we were talking about insulin resistance. And so how do we approach it? And this is where I'm gonna soon pass the baton to Dr. Aga. So here's the concept. So if we can maximize, so if we wanna get rid of those health problems. So the concept of insulin resistance is when we eat these, insulin promoting foods, mainly sugars and grains, and especially processed foods, that we have these high insulin levels, and that can lead to obesity and all these other complications and inflammation, as Dr. Aga mentioned. So how do we get rid of it? So we do whatever we can to lower the insulin levels. And so there's 3 ways that we can approach this. And Peter Attia, you can look up his blog. It's ATTIA, Peter Attia. He's a doctor, and he has a really deep dive podcast, and he talks about 3 pillars of health, like eating for longevity, and so anti-inflammation, et cetera. And one way is so you can imagine an X, Y, and Z axis, and one axis is how much we eat. So basically portion control. The second axis is what we eat, which is what I talk about a lot in my clinic, which is avoiding sugars and grains. And we're talking about that here. And then the other concept is when. So how much, what, and when we eat. And that's when we get into concepts like fasting, intermittent fasting, restricted time eating. So all of, if we can employ a strategy, so we can lower our insulin levels by reducing sugar and grains, like getting them out of our diet, or like some people will do intermittent fasting, like just to, and we can talk more in detail about that. So that's sort of a framework that I'll try to take with people I work with. And I'll turn that over. Now let's get into carbohydrates and your question, perhaps with Dr. Aga.
Yes, absolutely. And completely agree with this whole concept. And I came across this very interesting word few years back when I myself actually started on this whole low carb journey because of my underlying own health issues, and also the fact that I wanted to move into fitness, move into gym training, move into running in a good way. And I wanted to basically understand this whole concept where we are always told to exercise more and eat less. All of you will be very interested to know what the other day my daughter said, that for us, for everybody, usually exercise has been told, it has been projected in a very negative sense, in a very negative connotation, because basically you are supposed to exercise and to lose weight. It's never been told to any of us or any of the youngsters that exercise is not supposed to be done to lose weight. It's supposed to be done to make you feel good, to make you mentally feel good, physically feel good, to be fit, and to be able to do things at our ages or later on in our ages, which would be productive. The end step of any fitness or any exercise regime is productivity. And the other interesting word which I read a couple of years back was health span. So we are seeing that our lifespans are increasing thanks to all the medications and everything which is coming in, but the health span is going down so poorly. And Dr. George, you will be aghast to know the kind of fatty livers I'm diagnosing in 20-year-olds. Grade 2 fatty livers. I don't know what to say to them, So,
yep.
And India predominantly is very, very high carbohydrate intake country. We are suppose, I don't know how this whole concept of having a high carbohydrate breakfast. We eat a high carbohydrate breakfast after hardly 9 or 8 to 9 hours of fasting. Then we have an afternoon slump, and then we have some more of sugar laden tea. Then we have a heavier lunch, after which we have an afternoon slump, and this whole process goes on and on and on. And I think what Shalaka was asking me about the Indian food, which is rich in carbohydrates. So basically, our food is all centered around grains. So we start our breakfast with the typical Indian food of either rotis, which is the chapatis, which is grain, or things like beaten rice, which is poha in Indian language, or something like, or now people have been eating a lot of bread, but and also thanks to so-called healthy diet, the muesli, the granola, the cornflakes, they've all made their places. So that's and because again India predominantly is a vegetarian country due to various cultural reasons, a lot of people don't even have eggs. So to my patients, I try to encourage them at least add eggs. Okay, if because of some religious cultural beliefs you are not wanting to be a non-vegetarian, at least add eggs. That will make all the difference. And when it comes to eggs, add the whole eggs. Do not throw away the yolks. Add the whole eggs. And I think this Shalaka will come to it later on, but um, we have to it's such a big myth, it's such a cultural myth going on everywhere, is this fact about the grain being healthy. Nobody is able to understand that ultimately it's all broken down into sugars. Plus it leads to so much of the immune system breaking down, and gut, it's leading to so much of leaky gut issues. So well, it's going to take a while to change the mindset.
Yeah.
It will take a while.
Doctor, what can you say about the Indian carbohydrates specifically? You mentioned the grains earlier.
Yeah.
What about the sugars?
Yeah, so the sugars, well, as soon as we tell the patients not to have sugar, then comes in the gur and the honey, so the jaggery and the honey and all the various organic jaggeries, and it's all over the place. And Dr. George, because India is also, we are seeing a high rise in cyclists and runners. Suddenly there's an explosion of marathon running and cyclists and youngsters getting into it, middle-aged people like me getting into it. So I still see people are completely loading on sugars, on gur, on jaggery, on honey. And it's again, the myth is doing the rounds that this is healthy. I can't understand why people don't know that the ultimate breakdown of healthy, unhealthy sugar of any sort is going to be the glucose molecules, which is going to spike the insulin, which is going to lead to all the health complications. So as you know, Shalaka, honey and jaggery. Now we are against these two enemies. The white sugar, everybody knows. Oh well, let's not have the white sugar. But then the jaggery and the honey has stepped in a big way. And you must have seen a lot of advertisements. A lot of companies are, also posting it as it being healthy, as it being diabetes friendly, and all the biscuits, all the cookies, everything is now diabetes healthy. It's all good for the diabetics. I wish they would monitor their blood sugars. They will know what's good for them.
Yeah, that's true. Do you recommend CGM usage?
Absolutely. I do, especially in my diabetic patients. I always tell them, well, don't believe me. I mean, I might be wrong. It's not a big thing if I'm telling you not to have grains. Just measure your blood sugar. The one day you are feeling like having you're feeling like having honey, you're feeling like having grains, please go ahead and measure your blood sugar. The moment they see the spike, they understand for themselves.
Okay.
Mm-hmm.
Here, I think this is a good time to discuss water retention, edema, and pulmonary hypertension patients, and how carbohydrates, sugars impact that. Dr. George, this is a question for you.
Yeah. So when we see patients who struggle with fluid retention, Oftentimes we talk about avoiding sodium. And so especially in the American diet, it's pretty easy to get high amounts of sodium, especially in people who eat processed foods. So when you have sodium, what happens is water follows salt. So if somebody, again, I talked earlier about how the body tries to keep everything at an even level, right? So your sodium blood value will remain constant. If you take in a lot of sodium, then your kidneys are gonna retain fluid so that it dilutes and keeps your sodium blood level stable. So a lot of times we will talk to people about limiting their sodium intake. However, one other mechanism for how we retain sodium is actually through insulin. So when we eat a high carbohydrate diet, it actually signals, so insulin will signal to the kidneys to hold on to sodium. And with holding on to sodium, you also hold on to fluid. So when people go to a low carbohydrate diet, or eat keto depending on how low they go, if they actually get into nutritional ketosis, oftentimes there's no longer that insulin signal to the kidney. And so now there's less sodium retention. And so the kidneys will let go of the sodium, and then fluid follows the sodium. So that's one of the reasons that when people adopt a ketogenic diet, they oftentimes will lose 5 or 7 pounds right off the bat. It's not fat. I mean, hey, wish it were, right? But it's fluid, and you still feel better with less fluid. So that's one way that a low carbohydrate approach can help with fluid retention. And oftentimes, sometimes when people lose that sodium from going keto, as it were, it can lead to side effects, by the way. It can cause people to get headaches and constipated because they get dehydrated. They lose the sodium, lose the fluid, get dehydrated, and feel pretty miserable. And then they say, oh, why did I even try this? Blah, blah, blah. But that's usually a short-term side effect. And in people without pulmonary hypertension and without health problems that for whom it would be ill-advised, sometimes we'll increase the sodium intake in that setting so that they can kind of not have as much dehydration. It gets tricky with the PH patient or heart failure patient, et cetera. So it takes a bit of involvement of your healthcare team and coaching.
Okay. All right. I think now we have to talk about processed foods, particularly when we are talking about carbohydrates, especially the ones we have here in India, all the snacks mostly, right? The 4 p.m., 5 p.m. snacks. Dr. Aga, anything to say on that?
Absolutely. As you know, we all know, we have this whole, we feel this need. It's actually, again, it's not a necessity. The snacks are never needed. It's more of the addiction. It's more of our projection of whatever issue we are having. It's usually boredom, or it may be stress, or whatever. It's maybe stereotypes which have been built in since our childhood about the fact that there's something which we need to eat at around 5 p.m. or at around 12 noon. So actually, the snacks is something which the body really never needs. If you're busy, if you're working, you will just go for hours without eating anything, especially for the low carb people. Of course, the people who are on high carb, we all know that the fluctuation, the sugar spike happens, it crashes, it happens all over again. So, and India, I think it's copying what the Western, it's all coming in from from the West, and we see the markets are bombarded with all this processed food. My clients ask me as well, so okay, we've had this, we've had that, we've had this, and now what do we have for snacks? So I generally tell them initially, as a hand holding, I always tell them to maybe move into having some kind of nuts. But again, nuts, as we all know, they are extremely nutrient dense. Ultimately, I always suggest them to just keep stuff like boiled eggs in the fridge. That's a great to go snack. Or you could ultimately, if you are moved to just 1 meal a day or 2 meals a day, then just have your lemon salt water. And yes, salt, electrolytes, as Dr. George very correctly pointed out, is a major side effect with people who are slowly, steadily moving into low carb, or even people who have been doing low carb for a time and now are moving into strength training or are moving into running or cycling. because that's where our sodium potassium levels start falling. And we have to supplement it by taking electrolytes in the form of sodium, potassium, and magnesium. Magnesium supplements, very, very essential for everybody, not only for the low carb people.
Okay.
So I strongly believe there's some kind of a law has to be made against, like we have been started writing on the cigarettes. It's statutory warning. It's harmful for health. Similar warning has to be, there on all the processed and the packaged food. If it's printed the shelf life for, I don't know, 6 months, 2 years, 1 year, then we have to completely steer clear of those kinds of things.
But what about the snacks made at home? All the chudas and the, I mean, every state has its own version of something.
Absolutely. And it's a trifecta of, if you see something like chuda, which is a typical Indian snack, it's not a trifecta. It doesn't really have protein in it, but it's got that terrible combination of high carb, fried.
Yeah.
So it's got high carb, it's got high fat with a fat which is vegetable oil, and it's high on salt. That is actually studies have, and I'm sure Dr. George must be, will be able to talk about it so much better than me, but there are studies which have shown that it's literally addictive. It's so addicting.
Oh, yeah.
You cannot stop by just having a spoonful and thinking, well, your addiction center of the brain will light up like this. Even for people like me who are pretty much on low carb and keto since years, and we know this is going to happen, but you give me a bowl of chura and let somebody insist, okay, it's fine, you can just have a couple of spoons, and believe me, I'm going to eat the whole bowl up. That's
Yes.
how addictive it is. That's how addictive it is.
So,
Yes.
So you want to say something, Dr. George?
Yeah, no, completely agree. It's so when people think about going low carb, a lot of us, myself included, I'm a total sugarholic. Like that is my substance of abuse if I had the choice. And with stress, especially in this last year, I myself get prone towards sort of stress eating sweets. And if I have just a little bit, I want the whole thing. Like
Absolutely.
I can't moderate. It's like a thing. However, those cravings, when people actually go low carb and bring down their insulin levels, like the cravings go away. And
Yes.
so, and the energy cycling also goes away when we don't feed it. It feels crummy for a few days, maybe for some people even longer, like a week. But once like you're through it, it's like, do I need to eat? I'm not hungry. Do I need a snack? Versus like, I'm dragging, I'm tired.
Yeah.
We eat. It's important to know we eat for a lot of reasons. So sometimes we eat because we're hungry, and that's probably the reason, or because we should fuel our bodies. But sometimes we eat out of boredom, out of stress, out of like procrastination, out of just gathering with people. So socially we're supposed to eat. If we can divorce that, those drives from the why, I think that helps us in trying to eat more healthily and think about fueling our body, whether you're an athlete, physically, or an athlete in mindset. It's about how do you fuel your body, and you can still enjoy it. So by the way, like a high fat, low carb diet is really enjoyable.
Absolutely.
But it's switching that switch in the brain. And it's not, another thing that's important is it's not just about like willpower. So a lot of times we're taught eat less, willpower, don't give in.
Yeah.
But like we're driven by hormones. So insulin, and then there are these hormones called ghrelin that stimulate appetite, and they're all related. And so they trigger your brain to kind of want to eat. It's not like you're weak or have no willpower. It's just about hacking the hormones and bringing the insulin levels down. And a lot of the other stuff gets better.
Absolutely.
Okay. So I'm going to go to the next topic here now, which is fats. What are the good fats? What are the bad fats? And how much fat is considered to be good enough and no more?
Let Dr. George take the question first.
So here's how I approach fats. So again, I think we want to get away from highly processed fats, which is what you see a lot of in processed foods. Like, so for us, and you'll have to give the equivalents for what you have in India, but if I get a snack bar, there's going to be like soybean oil and those sorts of fats in it, and carbs and stuff. So getting towards the more natural fats is stuff that we use. Now, I don't have, religious reasons to eat vegetarian. So I'll eat butter, coconut oil, which is vegetarian, olive oil. and even lard or whatever. I mean, I don't buy lard, but I'll cook in bacon grease. Anyway, sorry for that. And so, those sorts of fats, which are more natural and less highly processed. The highly processed things are more like seed oils, so like soybean oil and corn oil. Those sorts of things can be more inflammatory. And the way I utilize fat is, so if you're going to eat 3 meals a day, like versus 3 meals plus snacks, or every 2 hours, like if you want to lose weight, don't be eating every 2 hours. It doesn't make sense. It didn't make sense to grandma. It shouldn't make sense to us. Like those high, frequent small meals a day doesn't really in the big picture make sense. But cutting back so that we're back to 3 or even 2 meals a day makes more sense. And so when we utilize fat in the diet to help us feel full, to feel satiated, that helps you be able to go from lunch to dinner without needing to snack. Versus if you have carbohydrate foods, you're going to be like, what's next? And you can't focus because you're like, what's for dinner? How am I going to get takeout? Whatever it might be, right? So fat for satiety is key. And those are the fats that I typically recommend, at least for people here.
Okay. And you, Dr. Aga, what about the Indian fat?
Yeah, absolutely.
Yeah.
And I think ghee is something which
Ghee.
has been used in Indian cooking since long time. And if you see, Shalaka, our grandparents and our forefathers were actually doing intermittent fasting and 2 meals a day. So
Yeah.
that's the hunter-gatherer or the ancestral diet. Even with the unknowingly, they used to, wake up in the morning and do a lot of work before the fire was lit and the food started cooking. And invariably, they had one meal at 11, the other, I think, at about 5. And that was the end of the story. Ghee was used so much in Indian cooking till the whole cholesterol issue came in, until this whole hypothesis came in. And when if you see the fat explosion in India, let me give you my example as I was sharing with you, and Dr. George, you'll find it very interesting to listen to. I was a very thin and a skinny child, very fond of overall eating, but usually used to be satiated with, because we were we were the non-vegetarian eating Indian community. So we used to cook a lot of non-vegetarian food in ghee. So I was a pretty thin, nice, happy child till my father had his first heart attack. And he also had his first heart attack because he was inactive and he was a pretty big bread and grain eater. But then he was told, my mother and my parents were told to completely stop any sort of oil. Ghee was the major culprit. Non-vegetarian meals was another huge culprit. Egg yolks were the third culprit. So all our cooking went back into the non-stick pans and the cooking without oil and all that boiled and the bland food. So my father, well, he ultimately had 2 more of his heart attacks and is still on a number of medications. And I, from a very thin child, landed up into a nice obese teenager. And I remember perpetually being hungry. This is I still have such deep recollection about the fact that I was supposed to have low willpower, as you very correctly pointed out. I was always hungry, always. And still till um, 42 years of my life, I faced this whole issue with obesity, with the fact I was always hungry, always tired, always fatigued, till I sort of got this whole low carb realm and I realized where I'm going wrong. And I'm now perpetually happy, perpetually healthy, and perpetually pretty much satiated. So ghee always used to be a great cooking medium. I still suggest to everybody, please move back into ghee. No refined oils, no mustard oil, no other refined oils. For those who are non-vegetarians, please move into tallow, lard, whatever. I do a lot of cooking in tallow and lard. I sometimes just cook my meat and I skim out the fat from the top, and I do the next cooking in that kind of the fat. Please move back into egg yolks and coconut oil, butter, and you're good to go. But again, a word of caution: do remember sometimes that some people do not go overboard with consuming all the 3 things together, because, like, again, in some people think that, okay, ghee is great. So they are going to put dollops of ghee over their parathas, over their dals, or all of those things. So there is where you're going wrong, because you're combining the carbs with the ghee. So take away the carbs, please have the ghee. I'm fine with that. But this concept of, okay, well, ma'am, you said that, the doctor, you said the ghee is great, so I'm going to have my 2 parathas with dollops of ghee on that. That doesn't make sense.
Right. Yeah. And the other thing too is sometimes people will, what I've seen in working with people here is they'll think, okay, I'm supposed to get fat and I'm supposed to get this percentage. So I've had some people actually like increase their fat intake just to get that percentage of fat. I was like, no. It's fat to satiety. So what does that mean? Feeling full. What does that mean? How does that translate? That means like, okay, you have lunch and you find yourself hungry at like 4 p.m., like lunch at noon, you find yourself hungry at 4 p.m. before dinner. So then instead of having a snack, and if you need a snack, okay, handful of macadamia nuts, like nice fatty nuts or something like that, fine. But then the next day, try to get a little more fat in at that lunchtime. Like maybe that was just a salad with minimal olive oil and it was all sort of good carbs, good fiber, a little bit of meat, but not enough fat. Just adding a little bit more olive oil or a fatty dressing could help sustain somebody through till dinner time. Yeah.
Right. Can I talk? I mean, you already covered Indian cooking media. What about Dr. Aga? What about dalda and margarine? Because this is so common in India right now. You're muted, doctor. Could you unmute yourself?
Never ever. Ghee should only be for all of those who don't want to cook in anything else. Please make ghee as your medium of cooking, and use the full fat milk. Take out the cream from it. Use the cream in your cooking, or take out the ghee from the cream. It's a very easy process.
What about butter?
Yeah, perfectly fine. So white butter, salted butter, everything is great. Everything is great for cooking, and well, the food tastes delicious as well.
Yeah.
When you cook it in butter or cook it in ghee, and you're happy with the flavor, you're happy with the sight, you're happy with the taste.
Correct. Okay, I'm going to move to a very important topic: proteins. Is Dr. George there?
Mm-hmm. Yep.
Okay. So my question to you: importance in pH and metabolic health. What is the importance of proteins in pH and metabolic health, and also in the pre and post transplant phases for patients like us?
Yeah. So, I mean, protein is definitely important. You need it for healing. You need it for wound healing, to stay strong, to have what we call lean muscle mass. So you can't just fill yourself on carbs and fat, for sure. And we're trying to get rid of the carbs. So, when we talk about carbs, fat, protein, when we talk about 3 macronutrients, which is a really like broad way of categorizing food types, right? But so protein is important. It's how we make building blocks and signaling molecules in our cells. And there are certain proteins that our body can't make. Amino acids are building blocks of proteins, and there are certain amino acids that our body doesn't make. So we have to get it from somewhere. And you can get it from vegetable sources too, but you have to combine and be smart about it. But anyway, proteins are certainly important. A lot of people, over here remember something called the Atkins Diet, which was when low carb first kind of went big. And a lot of people thought about it as a high protein diet. Oh, I need to have lots of eggs, lots of steak, but you can actually get too much protein. And too much protein can turn into glucose, like biochemically in the body, essentially, and can cause issues with insulin. So it's all about getting the appropriate amount of protein. And that's usually based on somebody's ideal body weight in terms of what we should get. There's a good chart on the Virta, VIRTA health website. Yeah. They have a blog, and that's usually where I point to and go to for making protein recommendations. But for somebody like me, 5'5", I probably will, I get about 15 ounces of protein containing food a day, 15, 16 ounces. I'm somewhat athletic, or I try to be, maybe not these days in the winter, but I try. And so what does that look like? That's like a breakfast with maybe, 4 eggs or 2 eggs and a sausage in the morning, lunch with If I'm in a rush, American diet might be burger, no bun, no fries, that sort of stuff, or like a serving of chicken with some vegetables when I bring my food, which is most days. Dinner might be, a meat, like 5 ounces of meat and a side of vegetables cooked in butter or ghee, etc. That's sort of what that looks like. And that's getting enough protein so that I don't break down lean muscle mass and not too much so that I'm putting on weight.
Do you see that the lack of protein impacts the exercise capacity in pulmonary hypertension patients, and therefore it worsens the experience of the disease in some way?
That's a good question. I don't know data regarding that. I do know, like, in patients who go a little bit, in people who need to heal, wound healing, post-surgical, et cetera, you definitely need to get adequate protein in order to do those sorts of things. That, I have a person that I coach with intermittent fasting, and he's greatly improved his insulin resistance and diabetes, but had some wound care issues. So my colleagues and I really tried to drive home, when you do eat that one meal a day, make sure you're getting, adequate
Enough protein. Okay.
Yeah.
Okay.
But I could not tell you data about protein in PAH specifically.
Okay. All right. Dr. Aga, proteins in India, both
Absolutely.
vegetarian and what people who are already eating protein, that they should eat more, or it's okay
Absolutely. We are a extremely protein deficient country where we just have all our meals are carbohydrates. And they are, again, we are still very diligently following the low fat, high carb, low calorie, frequent eating kind of a diet. And it's all carbs, all the choices are carbs. We are still so scared about the fats and the protein. So when my patients come up to me and say that, well, I hope we will not have excess protein. In India, I don't think excess protein is ever going to be a source of, because the kind of the meal plan with Dr. George says, that is, I think, something like what I eat myself. But well, if you tell that to a normal lay person, they will completely die of shock that this is too much protein we are having. And
Right.
not only pulmonary arterial hypertension patients, Shalaka, low protein has so much of impact. For people who are into even into walking and simple gymming and very simple things, you see them landing up into injuries. You see them having fatigue, having all sorts of problems are related to low protein. So the moment and again, I will stress, in spite of maybe, going against the cultural norms of our country, the kind of satiety, the kind of wellness and the feeling of wellness which animal protein gives, it's very difficult to get from plant protein, specifically the satiety. And I was also discussing with you in the morning that I did an experiment on myself, because a lot of people were insisting about the fact that, well, okay, paneer, the cottage cheese, high fat cottage cheese, it will be giving you a good amount of protein, and it's a vegetarian, low carb, etc., etc. Well, it did not give me any satiety. And I think definitely dairy was a cause of I always used to think that it's a cause of inflammation, and it happened to me. I did start getting anxiety issues. I did gain a bit of weight, which was water retention, and I was feeling
Dr. Aga, you're breaking. You want to take a moment? We've lost her.
let's
Dr. Aga, we've lost you. Your screen is also frozen. Dr. George, do you want to say anything more about proteins? Yeah. Oh, no, she's back. Okay, Dr. Aga, you're back. Yeah.
We lost her for a second.
So I would suggest to all the people who are hearing this or be hearing both of us, even if, again, I will insist, please add eggs to your diet. Even if you're not having any other source of animal protein, eggs, and especially for the children, both the whites and the egg yolks. Do not make this mistake of childhood obesity. It's just exploding all over the place.
And it has nothing to do with eggs.
It has nothing to do with eggs.
Okay.
Just give your children eggs cooked in ghee and let them be happy. And
Yeah.
all children love it.
So
Every
I have
child loves that.
Yeah, doctor.
So I have a question. All right, Dr. Aga, I'm coming to you and I want you to walk me through a typical diet. Let's say, and I live in India. Okay, I'm coming to you. I want a typical diet. First, like your diet, you said you're not vegetarian. And then second, if you're working with somebody who is, how would you counsel them? Like a little bit of specifics. What's an example of breakfast, lunch, dinner, including times you eat if you were going to eat low carb Indian?
Okay.
Can I also share your screen, doctor? Your slides?
Yes,
Can
absolutely.
Yeah, I'll do that. Yeah. You could start in the meanwhile. Yeah.
So a typical Indian diet, which is not low carb, it starts in the morning with usually nowadays it's bread, it's skimmed milk, it's a serving of fruit, and sometimes it's half an egg. And it could be usually bread with potatoes or bread with jam and something like that, right? People who think they are having a healthier breakfast would be eating millets or would be eating muesli or would be eating granola with fruit juice. Then comes our snacks. So snacks would be um, maybe tea with sugar, without sugar, and with some higher fiber cookies, which have now come in a big way. Again, lunch would be typically the chapatis, a couple of chapatis, which people would specify that it's without ghee on it. So it would be chapatis. It would be a serving of lentils, dal. It would be some salad, and again some green vegetables. Even for people who are non-vegetarians, do not take non-veg every single day. It's like once in a week types. And then typically the evening snack would be some processed packaged food, some snacks, and a late dinner. Usually Indians are taking a very late dinner, so the dinner is between 9 to whatever, 10:30, 11, and the dinner is almost similar. Or maybe for people who are bit of thinking they are taking a healthy diet, would be taking something like a salad and a soup, going, and that's all they are having for dinner. And then naturally they're waking up the next morning really feeling very, very hungry, so then they will be having again some healthy cookies with their morning tea. So that's what is the typical Indian diet like. What I start with is doing the hand holding. And the initial couple of things I tell the people is to completely stop refined oils, completely stop added sugar. I mean, stop taking the sugars in your in your tea, in your coffee, stop the fruit juices, stop the fruit in your morning breakfast. Okay, if you still feel that fruit is a must, please do not have it for breakfast. And
Oh, we lost her again a bit.
next to your morning breakfast. If you are
Yeah,
not,
sure.
one second. Okay, am I here?
Yeah.
So if not having eggs, then at least the other substitute would be cottage cheese. But as I found out on myself also, that's the reason vegetarians generally are landing up more into all the insulin resistant diseases, because paneer is just not giving the kind of satiety which, and the kind of, even the mental health issues, it's not just the same.
Dr. Aga, you just mentioned about vegetarians, but I think even the non-vegetarians in India, they think they're eating protein, but they are probably not eating enough, and they're eating too much of the other stuff. They're eating all the
Absolutely.
rotis and the naans and the
Oh, yeah.
biryanis and the burgers and the burger breads.
Absolutely.
So that itself, I think the whole country is addicted to these carbs.
Mm-hmm.
And so I don't think I really want to isolate the vegetarians in that sense.
Absolutely.
It's not just them going through insulin resistance and who are contributing to the diabetes incidence in India.
And the saddest is that in children, I have seen that when I ask the parents that what does your child like, what does the child want, because they keep telling me that they are finicky eaters, they are picky eaters, and I ask the child, well, would you like a nice, for people who are having eggs, wouldn't you like having lovely scrambled eggs with the cheese and some cream and as a breakfast? And they are like, oh wow, we would love to have that every single day. My daughter lives on those scrambled eggs with cheese. I mean, she's having that breakfast ad nauseum since I don't know when. But then the parents think that that's this, we know we can't do that. We can't give them eggs every day, and we have to give them some weird stuff like bread with potatoes stuffed into it or stuff like that. And that's when they have their crash. And I'm sure I'm seeing so many of other health issues in children, including mental health issues in children. So much, it's so much related to the food we are eating.
Right, right. Okay. Low carb. Now, you all, both of you all have been speaking about carbohydrates, and you all have already started using the term low carb. How is it impacting pulmonary patients or patients with chronic diseases in the pulmonary and respiratory phase, Dr. George?
Yeah, I mean, I think a big way, so when people have associated lung diseases, so there are various types. If you have pulmonary hypertension plus diabetes, obesity, if we treat the pulmonary hypertension, they will still have symptoms from their diabetes, obesity. If I put on 10 pounds of weight and I don't have PH or any lung diseases, fortunately, but if I put on 10 pounds and go up the stairs, I will be more short of breath. Like, it's just logical, right? And so a lot of times in my clinic, I'll just break it down with that simple aspect. And so, trying to address that by reversing the type 2 diabetes by going low carb. And we should define that for people, by the way. I'll do that in a second. But by going lower carb or no sugar, no grains, for example, or keto light, whatever it may be, reducing that burden helps people be able to breathe better. I've seen patients lose 100 pounds, like in morbid obesity, for example, or 60 pounds or this sort of thing. And they feel a lot better. And in one case, we had a person who has PAH, but we struggled with the stiffness of the left side of the heart, which was more associated with the probably weight gain, et cetera. And I mean, it was difficult. Like, every week it would be laboratory testing, going up on Lasix furosemide, down on Lasix, this sort of thing. And then the person, like, on their own volition, just had a switch flip and just went deep diving and went low carb. Not necessarily keto, like hardcore keto, but just low carb and eating healthy, and, corrected a lot of the obesity component with extensive weight loss. And now, like, the kidney functions normal. Still, this person still has pulmonary arterial hypertension, but it's a lot easier to manage because now it's really just the PAH and not PAH plus HFpEF, which is just, that can be really tough. And so we've seen that in multiple patients. We just published a paper in Pulmonary Circulation where we took a woman who had pulmonary hypertension by cath, probably from sleep apnea, obesity, did not put her on vasodilator therapy. It was mild, but it really was associated with sleep apnea, obesity, low oxygen levels. And she went low carb and reversed her pre-diabetes and lost a lot of weight, like 60 pounds of weight, and then went from, needing 5 liters at rest, 8 liters of oxygen on exertion in the mountains, to being able to walk her dog a mile without oxygen. So and so in that case, a lot of the improvement was, so if people carry a lot of obesity, it actually can lower their lung volumes. And we can see that on pulmonary function testing. And so her PFT significantly improved. And that was probably from the impact of losing that visceral fat and, whole body fat on her lifestyle. So we see this, again and again in various ways that it can help these other sides of the pulmonary hypertension. And especially when we're talking about multifactorial or multiple lung diseases that are associated with the PAH.
Before I go to Dr. Aga's pictures on low carb, another important question from some patients is, can you gain weight with this?
Oh, yeah. You can't. So there's nothing with impunity.
I mean, there are patients who want to gain weight, who have been extreme patients with congenital heart defects, some of them long-term patients who are very lanky, thin, and have never been able to gain weight. So is there something for them in this space?
Tricky. So it's funny because when I see like really thin people, like malnourished appearing people, and I want them to gain weight, I try to tell them, wow, you're like in the 1% of patients I tell to eat carbs. But that may not be the healthiest approach. I think perhaps getting more protein would be like if I were doing it and trying to do a low carb approach, well, number one, I would have them meet with their doctor and make sure they don't have hyperthyroidism or other etiologies, causes to why they're, very, very thin and malnourished. Number two, like, do they have a malabsorptive disease process? Like, it's important to have a doctor just think, oh, you're just skinny because of this, like, to make sure that they work up all of those things. Like, is there some sort of food allergy? Like, do they have a gluten insensitivity and they have celiac and they're just not absorbing nutrients? So make sure that there's not another reason, that it's not just the hypermetabolic sort of, or hypercatabolic state of, whatever chronic illness. Number two, then it'd be really working with a nutritionist about, supplemental, but probably trying to get more protein with this approach. And certainly more protein and fat. Number three, let's say you want to lose weight or maintain your weight. You can definitely gain weight on low carb. You can't do anything with impunity. So when people overeat the fat and the protein, you can gain weight. Like, it's not like a license to just eat as much as you want. And sometimes that's where people kind of get a little bit dismayed, it's not a free ride. Yeah.
Dr. Aga, are you there?
Mm-hmm.
Okay, I'm going to share your screen and you could show some the presentation, and you can show some of your meals.
Mm-hmm.
Great.
Yeah.
So I think these are the couple of meals which my clients have shared, especially the vegetarian clients. So they have substituted things. They've added this is raw papaya, which they have added on top. And here it's Began bharta. It's aubergine. It's roasted aubergine. So they've used this. It's a nice aubergine is a brinjal is a very nice low carb substitute. They've added some tomatoes on top, some spring onions on top. This is they've made the lentils, and they've added here. I think this lady has added grated coconut as well. So as to increase the coconut content. And could you share the next screen?
Yeah.
Okay, so this is she's stuffed. This is the typical what do you call it? Stuffed capsicum which she has made, and again she has stuffed it with grated coconut and paneer. So this is grated coconut and paneer. This is again coconut paneer, and she's added some nuts on top. So these are all substitutes. I keep asking people to add a lot of grated coconut. And of course, you have to see to it that you are adding good quality paneer to your diets.
So Dr. Aga, what we are showing here is how you can have a complete meal without including rotis or rice.
Absolutely. Here, I think this is what I had suggested to her, to make fried rice using cauliflower and cabbage. So I think that is what she had shared with me. Again, I do not remember what she had made, but this is all grated coconut on top, and some mixed vegetables she had made. And she's made it a habit of adding grated coconut on top of most of her meals.
So that's not cheese? That's not cheese? That's
no, coconut. I think coconut, maybe she must have added grated some cheese on top.
Okay.
So these are the, again, all of these, she's just added some walnuts to the meal. And this is mushrooms. So this is mushrooms which she had made with cheese, coconut, and paneer. So she had grated she had mixed them together, and she had sauteed all of them. And this was a dip she made with, I don't remember, she used some olive oil kind of a thing she made.
Okay.
So there are a lot of low carb. I think this is where I told her to start adding eggs as well. So she's added eggs, and this is some paneer. I think they do get some avocados in Bangalore, so she'd added some avocados as well. So this is we have to actually handhold such people in various phases, where slowly and steadily you reduce the carb content of the plate and you increase the fat and the protein content of the plate. I doubt if usually this is our typical palak paneer, which is an excellent low carb meal.
Right.
If you cook it in ghee, it's great for a meal. So it's just that I think for vegetarians in India, it's slightly difficult to actually go on keto for whatever people might say. They usually stay on a low carb. as long as their fasting insulin settles and the ESR comes down and they lose weight and they're feeling healthy, it's all good.
Okay.
But I do encourage them to add eggs, and usually they have started adding eggs now.
Okay.
Otherwise, the only processed food which I recommend, and this is a line I think I've stolen out of Dr. Ted Neiman's conversation, is that the only processed food I think he recommends as well is whey protein. So for the vegetarians who are, I feel that they are still not able to complete their protein content, then I do recommend to add whey protein, even though I usually do not recommend anything which is processed. But then any day to, if you need protein in your meal and you are a vegetarian, you need to, just add some, make it a dessert. Just add some whey protein to your Greek yogurt. And in India, the easiest way to make Greek yogurt is just hang the curd in a muslin cloth, and there you've got your Greek yogurt.
Your hung curd,
So, yeah, so the hung curd, and make all the dips out of the hung curd. So it's slowly and steadily how we handhold them into a low carb stage.
Okay.
Yeah,
People
question for
are
you.
doing great.
Quick question. So when you guys, in terms of yogurts, again, that hit the low carb phase, fad here. So there's like fat free and 1% and 2%. Is it the same in India?
Yeah, absolutely. Dr. George, it's all coming from the West. And the most interesting thing, it's flavored fat-free yogurt with fruit.
With sugar or fruit,
Now you, I mean, a couple of brands like Epigamia and all, and you you look up the carb content in a small jar of the yogurt, and it's like 24 grams of carbs. And I'm like, oh my goodness.
I have an interesting, another anecdote to share with you guys. We have a clinical trial here where we're using low carb diet to fix the second type of pulmonary hypertension, HFpEF, that's associated with diabetes. So we put people on keto diet. So we had this wonderful, one of our study subject members talk to us about how over the holidays, which was like sort of midway point, she decided that she was going to make desserts. So just because it's the holidays here and that we have a lot of dessert foods associated with, Christmas and Thanksgiving and that sort of stuff, our national holiday. So she made these keto desserts, and she and her daughter, who's both doing it, loved it. They were like, it's fantastic. And people that joined them, like, took a bite, and she's like, honestly, what do you think? And they're like, it's not very sweet. But yet the people who had gone low carb, it was like very sweet. Like once you give up sugars and processed foods, all of a sudden, like, a half a cup of strawberries or blueberries is like so sweet, versus when you eat the sugars, it's kind of your palate just changes. So I thought that was just really interesting. I don't know why I just launched into that. I guess the yogurt and the sugar. Yeah. So like full fat yogurt with like a little bit of berries would be amazing, and more satiating than the processed stuff with the sugar added in the syrup. Yeah, no.
We have to go to the main topic here, which is ketosis and how it is benefiting people with respiratory and pulmonary issues. What is ketosis? A quick 2-minute thing into how to achieve it. What are the different pathways to achieve it? And of course, Dr. Aga, the difficulties that you face when you are in ketosis in the initial period.
I think we've covered that about the electrolytes, Dr. George.
Okay. Yeah. So then what is ketosis? Why is it helpful to pulmonary patients, respiratory patients? Dr. George, yes, you could start with that.
Yeah, so we've been talking about low carb. So we should probably put a few definitions forward. And ketosis, like keto, is sort of one end of, it's very low carb diet. So when we talk about carbohydrates in general, we talk about grams of carbohydrates per day. So if people are diabetic, they're used to counting carbs, or should be. Maybe they're not. Maybe they haven't been coached appropriately. But this concept of counting carbs, in general, when we talk about for a very low carbohydrate diet, it's less than 30 grams total of carbohydrates per day. Not net. So what's net total? So you read the package and it says carbohydrates, and it'll say, total carbohydrates or net, and it'll tell you fiber. And the concept is like, if you eat fiber, it's not as readily absorbed. It's probably not going to spike your blood sugar as much. So those are sort of free carbs. So if something were to have, 10 grams of carbs, but 8 grams of its fiber and 2 grams might be sugar, or 1 gram sugar and 1 gram other, then the net carb for that would be 2. 10 grams total minus 8 grams fiber equals 2. And so that's like total and net carbs. So in general, when we talk about a keto diet, we're talking about going to 30 grams. Why use the word keto? So the concept is when you go to an extremely low carb diet, well, when you're in a normal carb diet, your body and like standard American diet, I guess standard Indian diet from what I'm learning, lots of carbohydrates, your body's used to using glucose for fuel. And it'll burn what it can, and then what it can't, you store as fat. And most, that's sort of how that happens, being very much oversimplifying. If you go extremely low carb, your body will still keep it's not like your blood sugar will go to 0 unless you're on diabetic medications. So by the way, again, or maybe not 0, but near 0. So again, anything we're talking about, don't make any changes without talking to your doctors, etc. Okay. Because you can do life-threatening things by saying, Dr. George said I should go keto, so I'm going to go keto. And then you may not wake up, right? Like, because if you're on insulin for diabetes, like it's very dangerous. So it has to be a part of a team, has to be a part of a plan. Like, it could be fatal if you go keto on, injectable insulin, et cetera. So, okay. So nonetheless, let's say people aren't on diabetes meds, or they have a plan with their doctor and they go extremely low carb. So what happens is the body starts mobilizing fat stores and actually using ketones as another fuel source, in addition to glucose, for, fueling your body. And so that's where we call it nutritional ketosis, trying to utilize the fat made into ketones to fuel our bodies and that's part of why it can take a little while to feel good. Like if your body is used to sugar burning and you're an athlete, for example, you don't even have to be an athlete. It takes a little while to get used to being what we call fat adapted. When I say a little while, it can take a few months. So when we've seen experiments looking at endurance athletes or peak performance athletes, and they do like keto diet for a couple of weeks, they're not going to see this huge benefit. If you see people who've been fat adapted over months, there actually can be a benefit, improved endurance and recovery, et cetera, with a low carb diet. So anyway, 30 grams is the definition. Nutritional ketosis is getting into this alternative energy state, and you can actually end up feeling pretty good.
Yeah. Dr. Pallavi, are you there?
Yeah, absolutely.
Yeah. So how do you, in India, how do you substitute the carbs? Are you suggesting they eat more ghee to achieve ketosis? Here, what is the the plan for most Indians? An overview, just an overview. Yeah.
The moment you move into fasting and you reduce your carbs and you add more fats into it.
You're not. We lost you, doctor. Dr. Aga?
It's just the internet connection a little bit.
Yeah. Dr. George, are there any trials in keto and pulmonary? Yeah, sorry, okay. Dr. Aga is back. Yeah. We lost you in between. Yeah.
I think the net's just going all over the place.
Yeah.
So at least an intermittent fasting of 16 to 18 hours. And people who feel better and are moving into weight training. So weight training is an extremely glycolytic activity, as we know, especially if you ramp up your weights. That automatically, if you are weight training or if you're usually if you're cycling or exercising in your heart rate zone, according to the Maffetone method, then you don't need much of fuel. But if you are sprinting, or if you're doing an HIIT, or if you are doing any other glycolytic activity in a fasted state with your salts and your electrolytes, your body automatically goes into ketosis.
Okay.
So I do not recommend very prolonged fasting hours. But again, I think that's a lot of more research, a lot more of work, and a lot more of thought has to go into.
So you're talking about using fasting to go into ketosis, right? To be in a ketotic
fasted
state.
To my non-cardiac patients, I usually recommend exercising in the fasted state.
Okay.
And as high as possible. I do not recommend cardio steady state cardio unless you are looking into training for a marathon or training for a long distance cycling. If you are looking into exercise only for your fitness, then any day your HIITs or sprints, your weight trainings is any day better.
PH patients anyway are not doing most of these exercises or weight training and all. So Dr. George, are you recommending that they do this once in ketosis, that they at least attempt it, some of it?
Yeah, I think it's fine. So, gosh, we've been so brought up, myself included, through my athletic history. You got to carb load. You know, if you're going to do a marathon, carb load. By the way, so one of the things that we'll say often is you can't exercise your way out of a bad diet. So, and marathon running, you would think 26.2 miles, you would lose weight. But we see plenty of people who perhaps carb load and run, you know, with a body mass index in the obese range, right? So it's very much nutrition driven. But we're driven, okay, we got to carb load. Turns out you don't really need to carb load. Like so there are times when we have people who do fasting, you know, maybe they eat. So there's different types of intermittent fasting. I know we're getting towards the end of it, but some people will eat within an 8-hour window, within a 4-hour window, one meal a day. Some will go multiple days fasting, which is another way to bring your insulin levels down super quickly. And again, with the guidance of your medical team, of course, because a lot of, just like going keto, if you're on diabetic meds and you just fast, big, like severe consequences can happen. So you need a plan with a team before doing anything like this, and good monitoring. Anyway, and you know, when I do that, when I've done that, and my colleagues do it, we still exercise. And in fact, I think it helps. It helps suppress appetite, to be honest. So if I get up in the morning personally and I exercise, I'm less likely to need to eat breakfast. Imagine that. And I don't even eat, I just wait till lunch. It's like, it's a total, I think it does something to our ghrelin levels.
It does.
And I don't see any reason why somebody with chronic disease couldn't do that as well. We need to just, I think, dissociate from, I need sugar in order to do any sort of exercise like that.
Okay. All right. Do you have anything to say about dietary requirements for post-transplant patients?
Oh, gosh. So that's a complicated topic and a good one. Very important question. In my prior life, I was a lung transplant medical doctor, actually. So I took care of a lot of patients and pre and post, and specifically post-transplant. So, you know, I think so post-transplantation, we see a lot of insulin resistance metabolic syndrome. So a lot of patients will be placed on prednisone, steroids, which, you know, as part of their immunosuppressive anti-transplant regimen, which can be associated with weight gain and inflammation. And there are no clinical trials, by the way. I have no trial data to tell you low carb after transplant, keto after transplant, or keto and pulmonary arterial hypertension is going to affect the blood vessels or the disease. So, you know, I think about it from the avoiding obesity and diabetes, and it just, you know, I don't think it would be harmful to eat the way we used to when we weren't obese and diabetic. And so I sort of approach it from that common sense approach. However, I think clinical trials would be really useful here. And a lot of us postulate that there could be some significant positive effects by being at least low carbohydrate and avoiding the processed foods in these populations.
Okay.
But transplant can be a little tricky because of the medications, how they interact. And so sometimes people can get malnourished. So it really, you know, meeting with nutrition post-transplant is important.
Okay. All right. We are almost at the end of the session. I thank you both for taking the time and the extra time here. Do we have time for audience questions, or should we close this?
No, absolutely. Please.
Yeah,
sure.
Can we take some audience questions? Okay. Audiences, please raise your hand if you have questions, please. And I will also open this up for chat if you want to leave your questions on chat. Are there any questions? Please raise your hand here. Does food have an effect on oxygen saturation?
No. So that's a good question. If yes, can you suggest some food items that are going to have a positive impact? So In general, no. I mean, only in the sense that it can lead to obesity and can cause issues with lung volumes, et cetera. Like an extreme morbid obesity type stuff. But in general, it really shouldn't have an impact on oxygen levels, aside from obesity.
But you did mention that with that one patient on whom you'd recently published a
Right.
paper, that the
So that was
requirement for supplementary oxygen went down, right?
Yeah, and that was associated with the weight loss.
Okay,
So,
all right. Okay.
Yeah, so she took a keto approach, heavily monitored keto approach, lost the weight, and was able to expand her lung volumes.
Okay.
Yeah.
A question from Richa. Is there any substitute for ghee?
Coconut oil?
Coconut oil.
Okay. And
but the unrefined one, right?
Absolutely, the extra virgin unrefined coconut oil.
And the Indian term for that, doctor?
The Indian term.
Is it still the kachi ghani? Not
generally, it's I don't know. It's kachi ghani is usually used in the with mustard oil, as I have seen.
Okay.
And I would not suggest any seed oil, in spite of a lot of people having good reviews about mustard oil. I would not recommend.
Okay. All right. A question on diarrhea and vomiting. Now, many of our patients experience diarrhea and vomiting, especially after an exertive day, a physically exertive day. And then, of course, there's the other side of diarrhea and vomiting, which is very normal, like food poisoning or, or an infection, bacterial infection or something. So what do you recommend in these situations? How is food interacting here with all this? And we have GERD, we have IBS, many of the autoimmune patients are on PPIs. So what is your take on this?
In my personal opinion, I think the moment you are on a strict low carb with a good quality fat and protein, most of these things go off. Again, diarrhea, constipation, I recommend magnesium supplementations. Sometimes there is low zinc as well. So if that could also be looked into. But usually if you're having good quality fats, good quality proteins, not taking grains, I would definitely then not recommend in IBS and rest of the other gut issues. I would not recommend raw food, and definitely coconut oil works wonders.
So this goes against the common known thing that fiber is required.
Oh, so, yes, that's another. I think that's
the raw food and fiber thing is coming into play here, and
it's just not needed. The amount of the fiber has been suddenly made into some big demigod, so it's really not needed. And in fact, the IBS patients suffer so much the moment you increase their fiber. You cut down your fiber, you give them the good fats, you give them the proteins, especially the good fats, and look at the way they heal. It's so just no need for, and raw food in none of these patients.
Okay.
So in India, you are always recommended, if you are having a bad gut day, then you are supposed to have the khichdi, and I always, and khichdi with the ghee on top of it. So I always tell my patients who ask me that, our gut is doing all these issues and what should we have the khichdi with the ghee? So I just tell them, have the ghee.
Have the ghee.
And take away the khichdi.
Right. Dr. Patricia, do you have anything to say on these gut issues, on diarrhea?
So the medications for pulmonary hypertension do include those side effects. But hopefully you're working with your pH specialist to dose the medications appropriate. Like, we kind of run into a hard stop if my patients don't routinely have vomiting who've been living with pulmonary hypertension for a number of years from the meds. If they are, there may be something about the dose or how we're treating, those medications. So that's really important if people are actually having vomiting to do. Diarrhea, pretty common with certain types of pulmonary hypertension medications.
Okay.
And so again, it can be a dose response to some of our medications like parenteral therapy, oral prostanoids. Okay. That said, I don't think there's any reason not to go low carb for those reasons. A lot of times when people go low carb, their GERD, their reflux gets better. And so I think it can be, beneficial.
Okay. Any supplements with warfarin supplements that can be taken with warfarin? Some patients are on warfarin.
Yeah, so avoid vitamin K when you're on warfarin, which is an antidote.
Avoid. Okay.
Yeah, avoid. Don't eat. Don't, because that's the antidote to warfarin. And so that's why you have to be a little bit careful and work with a nutritionist about vitamin K. So certain foods contain vitamin K, like spinach and green, that sort of stuff. It's not to say people can never have spinach, but they have to kind of either not have it at all or have it regularly every day. And their warfarin is dosed around, like sort of dosed with this consistent intake of vitamin K containing foods. So you have to be careful about that sort of stuff with that. But things like magnesium, potassium aren't, zinc, that's not going to affect, your warfarin levels.
Okay.
But that's a complicated question. So definitely meeting with a nutritionist to go through things and go through that list is very important.
Okay. Sodium levels, we've already discussed, in fact, right in the beginning, how salt is impacted. Salt intake itself is determined by your insulin levels. So do you want to still take this at it? Which kind of salt and what is the optimum level?
So this comes up really commonly. People are like, I want to use Himalayan pink salt, and I use sea salt. I don't use like the regular table salt, and so it's better. But in general, salt is salt, like in terms of our approach, and whether it's pink or white in color consistency, it's still sodium, and in broad strokes. So usually in patients who need to watch their sodium, we recommend, I usually tell people sodium in fluid, which is a really important part of standard pH nutritional therapy, is monitoring sodium in fluid intake to avoid heart failure, right ventricular failure, and sodium and fluid retention. So that is, I usually tell people 2 grams of sodium and 2 liters of total fluid intake in a day. And that's usually where we start with. My nurse practitioner, usually she lowers that threshold, so I get to be the good cop. But anyway, it's pretty hard to do 1.5 liters a day, but some people really will do so religiously. Does everybody have to follow a low sodium diet? I don't think so. Like, I have patients that have never had issues with fluid retention and their pulmonary hypertension is quite well controlled, and they salt their foods, and I'm not going to chastise them for so doing. There's no association of low sodium with survival outside of those people that just are prone to volume retention, et cetera. So none of this is ever really a one size fits all for every patient.
Okay. Menstruation and bloating. Is this again not introduce low carb or keto into your diet and you're taking care of that? Bloating with menstruation?
Absolutely. The moment you go low carb, most of all of these issues with bloating completely go off.
Okay.
The cramps, so many symptoms with bloating, with your period pains completely go off.
Okay. Are oats healthy?
I just read that question and I was thinking we should address that. Is it recommended to have oatmeal with no sugar, typical oatmeal with flax seeds, chia seeds, milk and apple? My to-go breakfast for everybody, just have your eggs. That's the easiest thing to do. In fact, boiled eggs, I love my boiled eggs, or just, throw in your half-fried eggs or do whatever with your eggs, but have your eggs.
And for those who are non-vegetarians, beyond the eggs,
anything.
What is your take on processed meats in India? Processed meats in India?
Yeah, I do not recommend a lot of processed meat in India because it comes with a lot of fillers. So my to-go breakfast for people would be eggs and cheese, eggs with cream, eggs with ghee, or
with veggies also if possible, right?
With veggies, with mushrooms, with whatever you may, with broccoli, carrots, whatever.
And now that we're talking about oats, how about the pohas and the upmas and the idlis and the dosas? And
absolutely no. Please do not. I mean, you can have it once in a while as a cheat meal, or you could experiment with the almond flour and coconut flour. They do turn out to be pretty well. Once in a while I do make my chapatis with the almond flour and coconut flour. I make a lot of Indian thing, that the Indian chilas with coconut flour. It tastes great. Just add eggs, add the coconut flour, grate some cheese on it. It tastes really delicious. So then you just experiment with it and do whatever you want, as long as it's not besan, it's not oats, it's not ragi. It's
not ragi? No ragi?
No ragi. Again, it's a grain. It's a form of millets. It's pretty high in carbs. If you see the carb content in ragi, it's pretty high. It's maybe more complex, but again, it's a carb. It's not, it's a grain, right?
But you rather have ragi than have wheat, rather have ragi than have rice. Is that a fair comparison?
No. I would rather have rice than have ragi.
Is
Any
it?
day.
Okay.
Yes, absolutely.
Okay.
If I do need to put in some amount of carbohydrates, especially maybe for people who are into really heavy weight training, they might be needing their evening dinner to have some amount of complex carbs. Then sweet potato, roasted potato, some couple of tablespoons of rice. It's not that if I recommend rice, I would be saying a whole plate full of rice, but a couple of tablespoons of rice thrown in, that's pretty much good to go.
So basically today what we are also telling telling patients like me is that you may have to eat differently than what your family is doing, right? Let your family eat
or like me,
for your own sake.
Like me be so strict that that's all your family gets to eat. So that ultimately your whole family becomes.
If you are the cook in the family, then yes, definitely get them to start this as well.
No, actually, like with my children, they realize that how much it helps them. So they actually, both my daughters are practicing intermittent fasting and low carb in a much better manner than me. Actually, they get tempted less because they immediately their body responds by bloating.
And there's mental health impact as well, a positive impact with that.
Yes, absolutely. Absolutely.
Okay. One question from Numshi. Does green tea have any effect on water retention in the body? No. But what about caffeine though in general? How does caffeine impact? I personally have had caffeine directly impacts me in the sense that I immediately get palpitations with caffeine,
yes,
any caffeine, tea or coffee. And the moment I let go of that, I'm fine. So sometimes I don't know if my palpitations are because of caffeine or because of pH, but I know that once that went out of my life, my palpitations went away.
Yes, it does.
So
absolutely.
Okay. All right. How to handle low BP with food? I have to reduce weight, but the meds are making my low BP worse. So I'm asked to eat every 2 hours. Eating every 2 hours. Yeah.
No, so are they on? Is that person on blood pressure meds? I wonder.
No, doctor. These are your bosintans, macitentans, ambrisentan, which are reducing blood pressures. Low. Right. Most of us have are on those medicines because the prostacyclins have not been introduced in India yet. So these medications are causing low blood pressure across the teams. Yeah. So how do you manage that? So this patient has been asked to eat every 2 hours to manage that. What do you have to say to that?
As to eat every 2 hours to raise blood pressure. I don't think I would do that. Yeah. I would ask the patient to ask for the rationale. If you see people who are asked to eat every 2 hours for low blood sugar, but then there are other issues that need to be addressed. Like you shouldn't have to ever really eat every 2 hours.
That itself we never recommend keep spiking her insulin, and that would
and then it's not and so energy levels are going to do this, and obesity is going to do this, and so that doesn't make sense to me as a way to manage low blood pressure from pH meds. So perhaps other adjustments need to be made, like medical adjustments for that.
Okay. All right. Are we more at risk for COVID? And do we add any nutrition? This is very important. COVID and nutrition, right?
Absolutely. I completely believe in the fact that COVID is all linked to insulin. It was an epidemic because of the very poor nutritional choices that we've done. And we've all seen it's linked directly to diabetes, to obesity, to hypertension, and to low immunity. So again, it's the low carb, the high fat, optimize your protein, optimize your fats, completely do away with grains, lower your carbs, lower your insulin resistance, improve your metabolic health, improve your health span, and
so
do some exercise.
You may still be infected by it, but the impact on the body is likely to be very little.
Absolutely.
Yeah, and you recover quickly.
Today it's COVID, tomorrow it'll be some other virus doing the rounds. But ultimately it's the metabolic health, which made so many of us at such high risk.
Correct.
So I tend to agree, but being, taking care of patients with COVID in the ICU, I think, absolutely, like metabolic syndrome, insulin resistance, that lights up as all of the risk factors, obesity, diabetes, hypertension, all these things that are related, and underlying chronic medical conditions. However, so what I usually say is, all right, follow the guidelines. So social distancing, wash your hands, wear a mask, like all of that is first and foremost in a respiratory borne virus, like to decrease transmission. There's like these people in the low carb community and who will say, we don't need to do any of that. We just have to go low carb, which is ridiculous and dangerous advice.
Yeah.
However, what I'll tell people in the same time is when we're in this quarantine, like Dr. Aga is saying, to improve, and we don't have a trial showing this, except it just makes common sense that if we want to improve our own body's health and immunity, do what we can to improve our insulin resistance.
Yeah.
You know, will that, I've seen people, unfortunately, young people. So again, you think of COVID affecting and putting older people in the ICU with these chronic medical conditions, but I've seen young, healthy, fit people without insulin resistance end up on the ventilator or even worse on like ECMO and bypass. So it's not 100%, it's not a magic pill. And it's just important to use that as yet another thing in your toolkit for how to improve your overall health with COVID, with influenza, with everything, sure.
Okay.
So, but don't think of it as a panacea.
Okay. Dr. Aga, does jaggery have iron in it? And would you consume jaggery for getting iron?
No, please. There's any day if you would really want to improve your iron levels, then have eggs, have any
livers, have livers. Liver. If you're a non-vegetarian, have liver.
Absolutely. Otherwise, just have eggs. Jaggery doesn't have anything in it, except for breaking down into sugar and raising your insulin resistance. That's all.
Gretel says an endocrinologist has asked you to stay away from cauliflower, broccoli, and soy. I also want to ask about soy in vegetarian meals.
Well, I would not
recommend. Thyroid. Okay.
I would not recommend.
Okay. And any particular reason why endocrinologists are against eating cauliflower, broccoli? Is there an autoimmune reason here? Or?
I think they are supposed to have goitrogenic effects.
Okay.
But what medically has been seen that if they are sautéed, steamed, or boiled, then they're perfectly fine for anybody to have. Well, still, if you do feel that you should stay away from cauliflower and broccoli, there are so many other food which you can eat, mushrooms and beans, and there's so much to eat. There's just not a lack of anything.
Okay.
When it comes to vegetables, I mean, you can just throw in any vegetables.
Okay. How much milk can we include in our diet? This is a dairy question, so.
I am again not a big fan of dairy and not a big fan of milk anyway. If for a person who would like to have milk, I would again any day suggest to take out the cheese from the milk and have it, because then that will reduce the sugar content and increase the protein content. The sugar will be all washed away in the water which comes out. So the galactose in the milk will be washed away, and any day the protein will become better. So I am not a big fan of milk. And if you do wish to have milk, maybe you really like having milk, and you are otherwise normal metabolically, then have the proper high fat milk. There's no use to have the skimmed milk and the low fat milk and the rest of the other weird sounding milks which are doing the rounds.
Okay. And one last question, pulses and lentils. And you could also speak a little bit about quinoa over here. Do they make for good protein sources in vegetarians? And even otherwise, even most of us Indians have pulses and lentils.
Well, if you would take 100 grams of any pulse and check out their carbohydrate content, it's pretty high, the carb content in pulses and lentils. For me, I categorize pulses and lentils as sources of carbohydrates, not as sources of protein. So when I designed a plate for a patient, then where would the patient get his carbohydrates from? Those, then it's there when I see the lentils and the pulses, and the protein source has to be entirely different. As I have again said, either a vegetarian source wherein I would place eggs in the vegetarian source, or paneer, otherwise your non-vegetarian sources.
Okay. And how many eggs are too many eggs?
I
would like to close on this question because
Dr. George would like to answer maybe that.
So there are no eggs left? No, I'm just kidding. When I run out of eggs, that's too many eggs. I don't know.
Okay.
There's no limit. There's there's a movie out there that likens an egg to a pack of cigarettes, which is ridiculous. I don't know if you guys, I'm not even going to say the name of the movie, but it's one of the propaganda films.
Yeah.
No, I think eggs are fine. If that's your protein source, I think it's fine. There were a couple. Well, Dr. Aga, I want you to answer too. What do you think about the eggs?
I think absolutely I share your thoughts. No, I don't think there are too many eggs as anything like that. And I think this whole cholesterol topic we'll have to cover in a whole entirely different scenario. You're good to go with eggs.
So egg yolks are not contributing to your cholesterol, right? Especially to your triglycerides. It is the carbohydrates, the sugars, which are contributing to your higher TGs.
Absolutely, absolutely.
That's a really important point. Yeah, the blood fats, the triglycerides really come more from starches and sugars in most patients.
Absolutely.
One of the things that's super, like for people who really want to do keto, and there are problems like familial hypercholesterolemia, where people have like an inherited tendency to get high cholesterol levels. So, I think it's a good idea, especially for people who are thinking about taking this approach, to get regular laboratory testing, baseline labs, and then laboratory testing. So what does that mean? So a comprehensive metabolic panel is like your kidney function and your liver function. So you can, regular doctors can definitely do this on an annual, with pulmonary hypertension, we check this stuff all the time.
Yeah.
So a comprehensive metabolic panel, it'd be good to know, like, what's your vitamin D level? What's your hemoglobin A1C? What is the lipid panel, fasting lipid panel? It can be non-fasting, but I like to get fasting labs. So what does the triglycerides and the HDL look like? Which oftentimes the triglycerides are high and the HDL, which is your good cholesterol, is low. And Dr. Aga mentioned fasting insulin level, which we'll often get as well, because measuring that, you can calculate this variable called HOMA-IR, which is another variable of insulin resistance. And we talk about diabetes, pre-diabetes, which we categorize based on A1C, but then there are people who are not endocrinologically normal. I call it pre-diabetes, but they may have insulin resistance that we detect with fasting insulin levels. And so getting those laboratory testing, and thyroid, of course, because that can throw off your metabolism, like getting all that stuff at baseline, and then maybe at 3 or 6 months after going onto this diet, just to make sure things aren't going off kilter, and also reinforce, like, I like data, geek out on data, also reinforces that it's a beneficial change and not harmful. So your doctor should. One other thing I saw too in the comments that I don't know if we missed it, but I don't want to gloss over it. So there were a couple of things that were like medical things, and I want to chime in. One person asked about, are there, let's see, I'm on low volitree, anemic, low platelet, and low energy dizziness. What foods are good? And another person asked, what is the remedy for shortness of breath at midnight? Are plants rich in oxygen help in getting rid of this? So when I see these kinds of symptoms, like, that puts up my antennae for, you need to talk to your doctor. So if you're short of breath at midnight, it could be heart failure. It could be untreated sleep apnea. Like, the first thing is to go, like, when we're talking about using food and plants and like fixing your metabolism, we're talking about fixing your overall, like, chronic, like, substrate of your body, but not like, take this, you'll be less short of breath. Like, anybody who says that's like, that's quackery. Do you know what I mean? Like, in the short term. So nothing like that. When I see those sorts of symptoms, I think, okay, they need to talk to their doctor if they're short of breath at midnight. It could be nocturnal awakening from asthma. Like, there's a whole differential for nighttime waking up with shortness of breath. The same thing with the volitree. So if there's low platelets and low energy, dizziness, and anemia, it's really important to talk with the doctor and also say, hey, should I be seeing a hematologist? Is it all the volitree? Or, is it something else that you have in addition to pulmonary hypertension and medications? A lot of people go on our meds, by the way, like we see this in clinic all the time, and then they get a new symptom or side effect. The first thing by them and other doctors, like at the ER, is, oh, they're on ambrisentan. It's got to be the ambrisentan, but it's not necessarily. They could actually have a GI bleed and not an ambrisentan induced anemia, right? And so it's important to really make sure you talk to your doctor about problematic side effects like that, especially dizziness. That's also worrisome. It could be something that's not tragic and serious, but it could also be something that's serious. And so you should just talk with your PH team.
Okay. I think let's close this session. The doctors have been with us for more than 2 hours. Thank you Thank you immensely for this generosity of time, for sharing your expertise. I will share your contact details or your blogs, your Instagram, Twitter accounts on our social media today and tomorrow. And on behalf of Pulmonary Hypertension India, I really, really thank you for doing this with us. It's our privilege, our honor to have someone like the two of you to talk to us about such an important subject. We are always confused about this subject. And now we know a little better. We will start doing better in our own lives as well. And we will encourage each other to do better now, at least with our nutrition and diet lifestyle. Thank you so much. Thank you everyone for joining.
Thanks everybody.
Thank you.
Have a great evening. Bye.